So you want to know what inflammation is. It's a very good question. Super important. The first thing you can do is actually figure out how to tell if you have inflammation going on. And there's a few key ways that we as therapists look for that, and you can even look for that. And that's going to be one of which is swelling in an area. So if you have hurt yourself and you see that it's swollen, that's a key sign there's inflammation going on there. You might see some redness there. You might feel pain. It's pretty common to have some pain associated with that. And then if you touch it or just even have your own sensation of heat in the area, those are all really key signs of inflammation. And then depending on what caused the injury to the area, you could even have some pus formation, which means that there's some bacteria there. And these are your ways of pretty much telling if you have inflammation. And then what it means. Inflammation, and the reason we have it is it actually turns out inflammation to some degree is a good thing. A lot of the time we think inflammation is bad, but that really isn't a directly true statement because healing is actually inflammation is the first step in the healing process. So when we have an injury to an area and cells are kind of broken in the area, part of those broken pieces turn into these messengers that tells the body like, hey, injury in an area. And so the body sends more blood to the area. In fact, so much new blood to the area, it's more than can be taken away, and that's what causes this inflammation. And in that blood is sent our immune system, and all these specialized cells go there, which can eat, right? All these eating cells. And so the eating cells start to clear away these damaged cells or even foreign cells that are causing the damage in the area. And so this is the good part, the first step in the healing process of clearing away dead tissue and debris and stuff. And so once we've done that, we're setting up the stage, if you want to call it, for healing. The thing is, if we have it go on for too long, those cells can start to eat and attack some of the surrounding tissue, which is still healthy, and actually cause more damage. And this is the reason in rehab we want to limit inflammation, because if we have too much, we're actually hurting the area more. So we can use some different kind of anti-inflammatory medications to help with that. And the other implication with rehab is when you have pain, you have a reduced desire to use the area, and that's also a good thing to some degree because it limits how much you're going to further hurt that area or kind of aggravate that area. So like I said, to some degree good, but if you're limiting your ability to use it, that might affect your ability to rehab and perform certain exercises that we want you to do. So some inflammation, good, sets the stage for healing. Too much damages the area, limits your ability to rehab, so that's kind of why we want to keep it under control.